Welcome to the Eastman Dental Podcast, where we hope to inspire, motivate, and provide education from our guests' experience.
This week's guest is Andy Noon. Andy initially trained as a technician, working at Guy's Dental Hospital for 15 years. And he then upped sticks, went back into education and retrained as an orthodontic therapist.
It is like a team, you know. No one's just a nurse, no one's just a technician, no one's just like an orthodontist. Like, it's a sort of a team effort, and everyone sort of appreciates one another's experience.
He now works in multiple specialist practices, as well as working in hospital, and as well as continuing to utilise his dental technology skills.
I'm very lucky that I love what I do, whether it be a little bit of dental technology on the side, whether it be orthotherapy, whether it be a little bit of teaching.
With your hosts, Josh Hudson and Julia Bruin.
So Andy, it's great to have you on the podcast.
Thank you very much for inviting me.
So first of all, kind of going back to the start, what first attracted you to a career within dentistry and more specifically dental technology?
Well, I had my braces as a sort of teenager. I was very blessed with, my mum's an ortho nurse, so I got sort of pushed that way. Had my retainer made by someone from Eastman, actually.
Okay.
And I was sort of enthusiastic, thinking, well, who does this? Who makes this? Did my sort of work experience in year 10 at a local dental laboratory, which I arranged myself. Thought, yeah, this is quite good. And then I found out about hospital training, and then I suppose the rest is like history, sort of 20 odd years on. Did my training at Guy's. Sort of 4 years worth of training. You're qualified after 3, and then you sort of choose your niche, which I don't think anybody knows at the end of your sort of 3 years of training what you want to do or what you even think you might even potentially be good at. So it was having my own braces first, I suppose.
So now that we've sort of got that background on you, that's quite interesting. I'm now trying to explore your early days in your career. So can you perhaps use 3 words that would describe those early years in your career?
Oh, competitive, definitely, between the other technicians. You don't think it's going to be like that, but it's like, who's going to be the best? But obviously someone has a little niche in what they're good at. Good fun, exciting. And yeah, I suppose ambitious.
Was it
as
everything
well.
you expected it to be?
Oh, not at all. Like I said, it was very difficult after the 3 years to think, what am I going to do? And I suppose with me, I remember one of my lecturers sort of in the 3rd year saying, oh, you're pretty good at orthodontics, I think you'll be good at this. And then I suppose you remember those silly little things, and then I suppose that's when the orthodontic part sort of came from. I had another year's worth of my training at Guy's once qualifying. Actually had a broken hand at the time, and a job came up, and I thought, you know what, in ortho, I'll go for the interviews. It can only be good practice. Went for the interview, I got the job.
This happens all the time, doesn't it? It's those chance sliding door moments, isn't it?
I suppose it's someone told me once that, if you go for an interview and sort of always feel confident that you're going to get that job or that role. So I thought, I've got nothing to lose. I went in there maybe too comfortable. Maybe I outshone sort of the current 4th years, which was unfortunate for them, but very fortunate for me. And I got to work with, some of the best people that wrote the book. And so I've got some very good friends as well. So, yeah.
Well, we're nothing without our patients, our colleagues, and,
exactly.
Our friends, really.
It's all about the team. Yeah.
So I think there's a few things there that I think was quite interesting. First of all, competitive. I don't think I was expecting that as one of the 3 words. So can you just tell us a little bit more about that element?
So when we were training, it was 4 of us. 3 out the 4 of us had done some kind of experience. 2 of the boys had worked in different labs, like private commercial labs. So they were actually pretty good at prosthetics, pretty good at a little bits of crown and bridge, which sort of us other 2, we weren't. So they always looked really good. I think one had already started the external college course at college. So I almost knew the people there. So it was a little bit established. And to try and keep up with these guys that had maybe been doing it for like a year even if just 1 year, it's a lot more experience than what you've necessarily got. So yeah, you wanted to try and drive yourself to make that slightly better special tray or something, as you're training, because you'd have to go show your lead or the next step. So yeah, it was, I felt like it's a little bit competitive. We probably look at it now and probably laugh, because one does crown and bridge, one's prosthetics, and I do a bit of ortho.
Everyone's got their niche.
Maybe that's why we diverted and did our own different things. So there was no competition in the end.
Yeah, so that's quite interesting as well. So how does, in terms of your training, at the end of your training, do people generally kind of go down into one of those niches of orthodontics or, like, say, crown and bridge, removable? How does that work?
That's what that 4th year is for. So you do about sort of 3-4 months within each unit, and then I suppose then you try and decide on what you're going to go for, or I suppose what sort of job you're going to go for. Obviously, having that hospital training, I think the training is really, really good, but you might not necessarily have the speed that you might have if you're in a commercial laboratory. I actually really loved crown and bridge. I still don't dislike crown and bridge. The thing about orthodontics that I liked is it's just quite clean cut as far as making appliances. It's just a little bit of wire bending, acrylic work, and it's quite quick turnaround. So, but yeah, I don't think anybody, do any of us know what we want to do it when we qualify. It's an open book, isn't it? Still is an open book,
Exactly. And I think, like you mentioned, it's those little pushes in certain directions by people or circumstances that end up
driving in a direction. Yeah, I agree.
So I'm then going to bring on that really key turning point for you. I think that there is always a little moment, isn't there, that makes you decide which path you're going to go down. And you obviously had a turning point in your life. 15 years into your career, you decided to do something completely and utterly different, but you did something quite brave. So what made you wanted you to go to that other side of the patient care, and then your subsequent training, obviously?
Yeah, I suppose I wanted to just develop. I wanted that opportunity to spend more time with actually more patient contact, have my own patients, for example, and just develop more, even as a person. A lot of people say technicians can be a little bit strange, a bit recluse.
They could say that same for hygienists and dentists. It's all right.
This is the great thing about this job. Everybody's a little bit strange, and we find out a few things about ourselves, I think. But yeah, I suppose it's just that fact of I just wanted that little bit more. It wasn't the fact of I didn't dislike what I...
And I'm assuming you don't regret it for 1 second.
Not at all. I'm very lucky that I love what I do, whether it be a little bit of dental technology on the side, whether it be orthotherapy, whether it be a little bit of teaching.
So talking about kind of going down those different pathways, my personal pathway is nothing to do with orthodontics, so it might be a bit of naive for me to ask, but can you tell us a little bit more about what an orthodontic therapist actually does? What do you do on a day-to-day basis?
So you basically work under a specialist orthodontist or, a dentist with specialist interests. Obviously anyone can do sort of orthodontics, like dentally qualified. I will take anything from impressions, records, to fitting braces, fitting appliances, removing braces, sort of making retainers. So anything that sort of the orthodontist, take x-rays, anything that the orthodontist sort of wants. You're sort of like the orthodontist sort of right hand, I'm going to say woman and man, because obviously there's not that many guys that do what I do. I'm a bit of maybe one of 20, I think. Give or take, yeah. It's about 400, I think, plus orthotherapists.
But presumably a number that's growing.
Of course, I can't keep up. It's been a few years since I've sort of graduated.
For a relatively new role within dentistry, it has come on leaps and bounds, and that's very exciting.
Yeah, so it's you're sort of working under the orthodontist, just sort of providing support.
So you've sort of talked about your everyday work in working underneath a specialist orthodontist, but I think you sort of touched on earlier the fact that you try and combine a little bit of your orthodontic technology with your clinical work. So perhaps talk us through a sort of average day where you might do those sorts of tasks?
So, say for example, we see a patient. They need a functional appliance, which is an appliance sort of to bring your lower jaw forwards, sort of skeletal changes and in the mouth sort of changes to avoid possible maybe surgery when they're sort of a lot older. Really good appliance called the twin block, which I'll probably make maybe a couple a week. It's one of my things that I really, really like. And obviously I know everything about that. Okay, so I know how to do the bites, I know what works. So the specialist tends to be, oh, you do that because that's like your niche. You know, what's the point of me doing that when you know where the bite needs to be? Because that's the sort of thing that I've been doing quite a long time. Another strange thing that, say I'm fitting some little bands, so sometimes we might put a little ring over the top of like the molars, okay, what could be any teeth, to have an appliance fitted or anything else like that. I can usually guess the size of the band within one or two sort of fittings. And I don't know whether that's because of the dental technology of two sides are just of recognition. It's really, really strange. But yeah, it's just something that I suppose I take for granted because I've just done it for too long.
I'm listening to all of this thinking you must be the most amazing asset to any specialist orthodontic practice. They're probably clambering at wanting you in the dental hospital because of your niche. As you say, you've got 2 roles here that you are continuing to use. That must be very exciting.
It is nice, and I think...
And great for your patients, let's be honest. It's
definitely.
really good, let's forget about it being good for you, but actually you're providing the most amazing service.
Yeah, I had a good example the other week in practice. A patient came in just for the possibility of just looking at having braces, and there was definitely a hospital case. Obviously, working in that hospital situation, there's a huge waiting list in that particular area for having sort of orthodontics. And then the specialist sort of came in after I'd spoke to him because I thought it might be a good opportunity just for him to come in. And then he was just like, no, I totally agree with what Andy said. Obviously, it's not me doing the treatment plan. It's not my treatment plan. He goes, but he probably has just saved you sort of maybe 2 years of being on a waiting list where we could then maybe give you a referral to the hospital, or you could basically do this, which is the treatment which we would do at a hospital, close the spaces, and that's it. We sort of camouflage it. Which is really nice because, and most of the places that I work in, it is like a team, no one's just a nurse, no one's just a technician, no one's just like an orthodontist. Like, it's a sort of a team effort, and everyone sort of appreciates one another's experience.
It's that whole thing of coming back.
Yeah, like my professor,
to working
last
in the
Friday,
best environment, isn't it?
He called me over, he was like, Andy, this twin block's not fitting, can we adjust it a little bit? And I suppose it's always hard with a little bit of scope of practice, we all have this sort of role to follow, but obviously being a specialist ortho tech, I have that ability of being able to adjust an appliance, which as an orthotherapist, you're not really allowed to do because you're activating it. So it's a bit of a grey area, which is always sometimes a little bit difficult. But if you've got someone with, say, a lot of experience in a particular field, then you'll go down that road of, doing the best for the patient, because at the end of the day, that's what we're trying to achieve, isn't it?
Exactly, utilising those skills if they're there.
Yeah, exactly. Or I think we had an appliance that didn't fit like 3 times, and it was out from a commercial laboratory. I just said, I'm just going to take it home and make it. It's like an hour out my life that, all right, I won't get back. But at the end of the day, patient came in, fitted perfect the first time. It was just like, that's what we want. So, yeah, unfortunately. Fortunately, it's nice to be able to use those skills. I'd never not want to stop doing one or the other. I think it was a difficult sort of thing that I had to choose when I qualified as an orthotherapist. They were like, what do you want to do? Because I did 50-50 while I did my training. So obviously you're going to go to the new step. So I chose orthotherapy, but I still like that little bit of technology on the side.
Do you think you'll always keep that? You'll always
100%.
That element?
100%. I think everything, it's like all goes full cycle, doesn't it? It's like trends and fashion, isn't it? I'm sort of currently looking at the moment of possibly setting up a laboratory with a specialist.
You're going to say wearing flares for a moment.
Yeah, well, that's why I'm a big, you should never throw anything out, should you? Especially when I've just hit my 40s. So, yeah, you never know what's going to come back. I'm not going to grow anymore, I don't think. Maybe a bit wider, possibly. But yeah, sort of going full cycle, they've got the possibility of maybe potentially setting up a laboratory with a really good friend and like the specialist that I mainly work for during the week, and open sort of a digital lab possibility. So yeah, I'm never going to stop having that sort of that passion for both. You know, I think they might even want me to do maybe a little bit full-time technology, which I don't know if I could do that because of the patient contact, you know. I think they might be a bit upset.
So it seems like there's a huge benefit from your previous career into your new career, and like we've already talked about, that's been really beneficial for the patients. But is there anything that you wish that you'd known before making that jump, before deciding to do orthodontic therapy? Is there anything that if somebody else was going to do that you'd give them advice on, or that you wish that you would have known?
Well, yeah, the first couple of days after starting the orthotherapy course, I thought, what have I done? What have I done? Why did I do this to myself after such a long time of wanting to get on the course? Because it was hard.
Because you were comfortable, I suppose, and you were experienced in the job that you were doing.
It was institutionalized, isn't it?
Yeah.
We get stuck in something that we love, and you think, oh, should I leave? Obviously, most people that do orthodontic therapy, they've already done the orthodontic nurses qualification, and that is a really hard course in itself. So any nurses, I definitely recommend doing that. You could just be a graduate out of school, just like you could do when you're with hygiene. But yeah, sort of maybe do some pre-reading, because obviously coming from that technical side, doing a little bit more anatomy, you know, sort of 15 years on was just like, get the books out. And you know, I'll be honest, I started at the lower end of the class, and it was a little bit, it put me to the test. And then, you know, I'd like to think that when we got to the end, I think when we did some of our exams, I was almost like second from the top. On the top, she's a qualified dentist from Bangladesh, so you know, she knew her stuff. So it drives you, doesn't you, to do better for yourself. Lots of reading. I think in general just enjoy it, you know, because life goes by fast, and that course goes by very fast as well. Before you know it, you're sitting those Royal College exams, and the nerves are there, and you know, everyone's just human, aren't they? So just enjoy it, but maybe read. Do a lot of reading beforehand. Prepare yourself for it, because I thought I was prepared, but maybe not as prepared as I should have been. But
be motivated.
Exactly. Be motivated. I was very lucky because I had my son sort of the Christmas just after in the summer I started the course, and then Joshua was born in December, and you know, I had a newborn baby. We were doing my midterms, and I was sort of doing 3 o'clock reading in the morning, feeding him, and then reading at the same time. So he was my main passion for just like to do better. I didn't have the ability to fail. I had to pass because, you know, I had a family to support. So I was like very lucky in that. Which I think most people will find something. It's not just for themselves. It's that next chapter in your life, isn't it?
Do you know, I mean, we have a number of students here who have families, and I have to tell you, in my experience of being here, the people who have got families tend to bring something definitely unique to their group, but also to their patients, because I think it's called life experience. I'm not disputing that our bright young things straight from school aren't entirely able to manage the course, but I think those people like yourself who've got that little something else going on in their life is a great motivator. So thank you for sharing that. In dental therapy at the moment, this is quite a hot topic in the sense of with the NHS provision for patient care, that they're realising that there's this wonderful opportunity of very well qualified people being able to provide treatment for patients. So do you see orthodontic therapists going down that role and perhaps expanding their role within specialist practice, hospital setting?
Definitely, I don't see why not. There's so many people unfortunately not doing NHS dentistry. It definitely seems to be, it's not dying out, but there's so many areas where in community, you know, because you're servicing a community, especially if you're doing that NHS. So this is what it's nice, because, you know, you walk around the local town centre, you might bump into a few people you know, but there's definitely, why not have those skilled people providing that care if they're there to do it? I do. I think definitely, hopefully our role can provide more help. And again, it's what I think. It's a lot of it's down to trust. You know, as a therapist, sort of every other visit, you should be sort of calling in the orthodontist. You know, most of the time the orthodontist comes in with me. He's like, "So what we doing today, Andy?" You know, and I was like, "I was thinking this." You know, and usually they agree. It's very rare that it's different, because I'm very lucky because there's a really good respect for one another. Whereas in maybe that someone's not has had that little bit extra longer experience, they're a little bit more nervous, and they'll be like, pull the orthodontist in.
I think that's an interesting point that you make about respect, because I truly feel, as a hygienist who's relatively established in her career at the moment, having, you know, been qualified for over 30 years, that I have a different level with my colleagues now than I did 30 years ago. People are much more valued in our profession. So I'm really energized by hearing that you feel as though orthodontic therapists are championing that side of their treatment provision to patients.
The Royal College do like a specialist wire bending course, which I've done, which one, I don't think any therapist has probably ever done before, and I doubt a technician's done before. And obviously it was run by like the people that wrote the book, and some of the people that I really, really respect in orthodontics, like the professors, like the dean of like sort of the Royal College. And they would laugh in front of all these other people, like, oh, you know, and I was doing the wire bending, and I was, without sounding big-headed, one of the better ones in the class. And then even doing that, obviously I'm not supposed to do wire bending, but in the hospital situation, I would be getting asked all the time, well, you do that, and then you show me, we'll look at it, and then we put it in. And they utilise that skill set, which I think is great.
Yeah.
And I think if you've got that satisfactory sort of supervision, you know, I'm not being left on my own to just, you go do what you want, because that's not the way we're talking about it. We're talking about in the fact of, if you've got that niche or that skill set, then I think you should use it, totally, you know, within that scope of practice, which, like I said, it's grey area, and it's a bit vague, because it's an open book.
So what in dentistry, in the dental industry, do you think everybody should either start or stop doing?
What should they start doing?
Or stop. I mean, it doesn't, you know, you can...
We'll never stop caring. I think we always have to, I think if you don't, I think there's quite a lot of dentists out there that don't really enjoy what they do, and they should do.
Do you think it's the same for all dental people? You just mentioned dentists, but actually, do you think it would be the same for orthodontic therapists?
Maybe you've just been doing it a long time, and just, I don't know, you just need to have that little bit of variety, I think. Don't stop caring. Just stay passionate about what you're doing. You know, I always believe that the first time you meet that patient, it's all about your rapport. You know, you want that patient to feel comfortable, because most people are scared stiff of walking into that dental surgery, no matter what you're doing, whether you're just going to take some photos or you're going to do a fill-in or whatever. Yeah. And I always think, and to this day, I still think about how I felt the first time I met that patient. You know, I was scared stiff within internal, but you can't show that to the patient. Yeah. You can't let them know that you know you're not 100% like sure on it, you're doing the right thing.
We've been there.
But as long as that you make that patient feel comfortable, you know.
It's one of those funny things when we're talking like this, it sort of reminds me of something that I say to the students here at the Eastman all of the time. You know, treat those patients how you'd like to be treated.
We're only human.
And if you do that, you'll have a very long and very happy career, and you'll have some good patients that you'll grow old with. So
I say that to the patients of, like, you know, I'm an orthotherapist, you know, it's not my treatment plan. I'm here to provide that care for you. And it's not, I always think that honesty is super important. And maybe sometimes I might be a little bit too honest with a patient, but I like them to feel comfortable, because the fact of, I'm just as human as them. Just because I'm going to put my hands in their mouth, I'm going to put their braces or take their braces off. whether I've met them for the first time or I've done most of their treatment, you know, I'm just the same as you. And enjoy it, you know.
So you mentioned about people being motivated and passionate, and kind of following on from that, what advice would you give to a colleague who maybe like you was thinking about changing direction or doing something different because maybe they've lost that motivation or that passion? So what advice would you give to someone who's in a bit of a work rut?
Just say go for it. You got nothing to lose, because you can always go back to doing whatever it is you were doing. It is scary at first. But yeah, like I said, you've got nothing to lose. If you're passionate and you enjoy the part of dentistry and you want to go whatever sort of way about it, just go for it. Try and do whatever courses you can do to support that pathway, and just go guns blazing. That'd be my only advice. Yeah, you've got nothing to lose.
I think it's a really interesting point that you make as well, that by being professionals, like you say, we've always got that to fall back on. If you'd gone along that route and it hadn't worked out, you still had a huge amount of experience as a orthodontic dental technician. Or if you're a hygienist that decides you want to set up your own business, you can always go back to being a hygienist. That's the benefit of being in a profession, which, I think people probably should bear in mind if they're thinking about maybe.
Well, it's never going to die out, is it? We're very lucky that everyone's got teeth, and it's just going to be...
Yeah.
So we were talking earlier about your 3 words that would describe your early career in dentistry, and those were very interesting 3 words. So what would be your 3 words that would describe your career fast forward 20 years?
It still probably is competitive, because I'm quite a competitive person. I want to be the best at what I do. But I suppose now it's just I'm comfortable, and I'm still passionate. So it's pretty simple for me now, because like I said before, I enjoy what I do. I haven't really got a worry, because there's to the question I just answered. There's always a job. There's another job, and there's always someone offering you a job as well.
But you are you, and that's what makes people, I always think that people don't know when they go and see a dentist or a hygienist or an orthodontic therapist or a therapist, they don't know what sort of clinician you are. They have no idea. All they know is that the waiting room was nice, didn't cause any pain, I could get an appointment quite quickly. So, I think you are unique, and I can recognise your passion there. But a little bit like Josh was saying, how are we going to get people energized out there who are listening to this podcast, who are thinking, what can I be inspired to do? What can I be motivated to do? Share those passions with us. How do you keep your passion going?
See, I'm very lucky that I thrive off the patient. I love putting braces on people. I love that first meet. I love seeing that little nervous child walk in and thinking, I'm going to spin this around. I'm going to change the fact of everyone's scared of going to the dentist. And I joke, I say to the patient, we're not like normal dentists. We're just doing orthodontics. It's just some braces on your teeth. It's not like lots of drilling and things like that. So you can keep it sort of plain. And then from the outset, it just makes it quite smooth.
So we've talked about those early stages, the transitions throughout your career. We've talked about the 3 words that you describe kind of where you're at now. But what do things look like going forward? I know you mentioned possibility of maybe being involved in setting up this lab. What are your kind of aspirations going forward? Or do you think, do you know what, I'm quite happy with the point that I'm at, and I just want to make the most of the position that I'm in?
It's a really good question. So funny enough, one of the dentists that I work with, he was telling me about a course for dental care professionals, which they can do 4 years worth of training to basically train to be a GDP, which is something I was quite interested about. Actually, I asked him last week. I was like, "Did you find any information about that?" And there was a guy that trained as a nurse, who'd moved forwards, done the extra courses, and it basically is on that course. I think it's Aberdeen and King's College that do that. Never say never. Yeah. I like the variety of sort of working maybe one day in the hospital. I like the private practice. I like the NHS practice. I probably prefer NHS a little bit more than private because you can be a little bit more straightforward with the patient. Whereas when someone's paying, you've always got to be that you've got to be that little bit nicer, I suppose. I can't be any much more nicer than I am.
I can't believe that's difficult for you. I can't believe that's difficult for you.
Yeah, and I say that to the NHS patients. I was like, I don't care if someone's paying X amount for their private dentist orthodontics, then that you're getting the same amount of care, the same thing. We're not going to do anything different. So, yes, there is the possibility of maybe doing this little bit of a lab. I hope that's not something that they maybe want me potentially full time. So, yeah, it hasn't gone full cycle to maybe necessarily just go back into dental technology because I wouldn't like to do that full time because I would miss the patients. And I would feel a little bit like I'm letting down the ones that are already in treatment. And to try and finish everybody, that'd be impossible. Yeah. I probably see 150 plus people a week.
With those long treatment plans as well. It's not like
wow, that's a lot of patients. 150 patients a week.
Yeah.
Wow.
But yeah, I don't know. But Monday to Wednesday is like
busy guy.
NHS, and then it sort of dies down as the week gets closer to the end. But yeah, I don't know. It's an open book, isn't it? What's the next chapter? Did I expect to be invited to be doing a podcast on my extraordinary career path? No, not at all. But yeah, we never know what the next step is. But
well, we're super pleased to have you here.
The book's open, yeah.
Lots of options.
Might come back again and let you know if I'm doing dentistry in a few years' time. We'll see. I'm still young enough to maybe do it. I don't know. We'll see.
Yeah, go for it.
Again, but maybe then that makes the difference if I could do my own treatment plans, I suppose. But I don't know.
We've had a student who's done dental hygiene here and then gone on to
I've got a good friend who's a technician. She did Max Vax and stuff, and then she went to be a GDP. And they say that some of the best, no offense to GDPs, but some of the best dentists have been dental technicians previously. So
one of the guys
again, it's
I
just
work
having
with
that
in
eye,
private
I suppose.
practice.
Yeah, it's just a mixed bag.
Yeah,
you can never have enough experience, can you? In whatever you do. So yeah,
we'll get you back on when you're a consultant orthodontist then.
I'll be retired by then, hopefully.
No,
hopefully.
Got years left in you.
Yeah, exactly. And I suppose that's the nice thing about doing a dental technology. I suppose one of the orthodontists used to say that I was like the man with a golden eye, like bracket positions and stuff like that. But I suppose if like my eyes start deteriorating, I suppose I could get some loops. But they say if you start using loops, you don't stop. So I want to just try and veer away from that for the moment. But then I suppose my hands aren't going to give up on me. So I could maybe do a bit of dental technology closer to the end. We'll see. To wean myself out of orthodontics.
Well, thank you so much for
Our
joining
pleasure.
us and for
thank you
sharing
very,
all
very
of your
much.
experiences. And I'm sure that's been really beneficial and useful for everybody that's listened.
Yeah, I think it's great to champion this relatively new profession that the GDC have established. Thank you very, very much for coming.
It's constantly changing as well. So, thank you for having me.
We hope you have enjoyed listening to this episode. We would love to hear your suggestions for future guests. Remember to follow us on social media using hashtag the Eastman Dental Podcast. And if you like what you hear, please like, share, subscribe and listen out for future episodes.